many of you out there think you know how to recognize high blood sugars and low blood sugars? All right. Well, that's what we're going to be talking about today. So put down your lightsabers and get out your lifesavers, because today's talk is about managing your sugars. Let's get to it. Hello everyone, welcome back. This is better. Hey, you know you're in the right place to get all the tips and tools you need to tackle diabetes. So let's get to it. I'm Dr. Mack and this is Diabetes Solutions. So, to recap very briefly, last week we talked about how when you eat food, that food breaks down into sugar or glucose and travels throughout your bloodstream. Insulin is the one thing that takes that sugar out of the bloodstream and sends it into the muscles where we burn it for fuel. Today I want to show you what a good level of your sugar is. Oftentimes, diabetes patients are told you need to check your blood sugar 1 time a day or 4 times a day. Check it in the morning, check it before you go to bed, which is fine, but you need to know why you're checking it at certain times and what the goal is for that time of day. If you're just randomly checking your blood sugar, you oftentimes don't know what to do with the number, and that's very frustrating, often leading people to just simply stop checking their sugar. So what I want to show you today is where your sugar should be from the time you wake up until the time you go to bed. And let's represent that day like this. So let's say when you wake up and your blood sugar is here. We'll talk about what that level should be. As you eat breakfast, your sugar starts to rise. And then as insulin starts to move the glucose, the sugar out of your blood and into the muscles, it starts to drop. And it drops to a certain level and then stops because our body sends out another enzyme that gets rid of all the insulin that's circulating, so it stops dropping your sugar. You don't want your sugar to continue dropping to 0 because then you'll be flat on your face and you won't be able to see my videos anymore. So this repeats with each meal. So that's breakfast, lunch, and dinner, and then you go to bed. So this essentially represents your day's worth of sugar from the time you wake up to 2 hours after each meal until the time you go to bed. Now, let's have an example of a patient that's maybe on 1 diabetes medication or no medications and their A1C is relatively well controlled. How often should that person be checking their blood sugar? Typically, I say if your A1C is controlled, if it's less than 7, or for some people less than 8 or even 8.5, depending on your age, if your A1C is controlled and your provider is saying you're doing a great job, oftentimes you can get away with checking your sugar maybe one time every few days, 3 times a week. One thing we do know is that if your sugar is controlled, there is no evidence that shows checking your blood sugar more often is going to keep you under better control. But if you are going to check your sugar, make sure you do it at specific times. Let's use another example. Let's say you're on mealtime insulin 3 times a day as well as bedtime insulin. Now if you're using insulin and you're fine-tuning the dose, oftentimes you'll need to check before the meal and 2 hours afterwards just to see if your dose is correct for that meal. If you're on no insulin, you may be able to get away with just checking when you first wake up in the morning or 2 hours after one of your larger meals. Now what are the goals for these times? Basically, depending on, well, if you ask endocrinologists or look at some of the guidelines, they say your sugar can be as low as 70 in the morning. So we'll say a normal range in the morning is 70 to 130. Now, if you ask any of my patients, as your blood sugar approaches something as low as 70 when you're first waking up, oftentimes people don't feel well. So I'll tell people, if you're at 100 to 130 in the mornings, that's not bad. Now again, keep in mind, what I'm telling you is just based on my relationships that I've had with my patients over the years. If you're a physician, if you're a diabetes educator, if whoever is taking care of your diabetes with you, if they're telling you different numbers, then by all means, please listen to your providers. I'm not here to replace your actual medical advice, but hopefully I can give you some tips and tools that will help. So again, waking in the morning,
Anywhere between 72 or 100 to 130 is absolutely normal. This gives us a good idea of how our sugars did overnight. If you're on, say, a bedtime insulin, oftentimes I will use this morning number to guide dosing or adjusting the dose of that insulin. Now let's say you want to check your sugar after you just created a new dish and you're going to try the food to see how it affects your sugar. And let's say you're going to do it out here at dinner time. What I tell people, if you're curious about what a certain dish, a certain meal is going to do to your sugar, check your sugar before you take the first bite and then check your sugar 2 hours later. That will tell you how much impact that glucose in that meal had on your sugar. What you're looking for is a rise of about 40 points. Now, why is that important? Because let's say your diabetes isn't so well controlled and before a meal your sugar is already at 180 or 200. But you're really trying to eat better. So you eat a healthy meal that has low carbohydrate, a medium amount of protein, and some healthy fat, and your sugar goes up 40 points. So you're starting at 200, you go to 240. That means that the meal was appropriate. Now we just have to figure out why your sugar was 200 to begin with and work on that. Let's say your sugar is absolutely normal before the meal. You're out here at 100 to 140 of your pre-meal sugar. And then you have your favorite big bowl of spaghetti. And you check 2 hours later, and now your sugar is not 100 or 140, it's 240. That was too much carbohydrate. So this little tip can help guide your portion size and how you choose to make up your meal. And actually, we will get to that in a little bit when I answer one of last week's viewers' questions. But for the most part, if you're going to check your sugar once a day, I would check it first thing in the morning one day, 2 hours after breakfast the next day, 2 hours after lunch the next day, 2 hours after dinner the next day, and maybe occasionally at bedtime. And of course, if you're feeling odd, if you're ever feeling shaky, sweaty, irritable, more grumpy than usual, as my wife would say, that would also be a good time to check your sugar because you want to know if it's high or low. In an upcoming segment, I'm going to show you ways to tackle low blood sugars, and I'm going to demonstrate by actually checking my sugar, sampling different products that should help raise our sugar or not, and then checking my sugar afterwards. That's in the upcoming segment. We call that the rule of 15s, but we'll get to that. So, bottom line, if you're checking your blood sugars, either check when you first wake up or 2 hours after a meal. That kind of gives us a big picture idea of what your sugar is doing. If you want to know what a meal is doing to your sugar, check before you have the first bite and 2 hours later. If you go up 40 points or less, that's a good thing. If you go up much more than 40 points, then you need to rethink that portion size the next time or add more veggies or less carbohydrate. Or do the old trick of drinking a big glass of water before you even start eating. That way you're already starting to feel a little more full. So that's where I tell my patients throughout the day to check their sugars. And again, if you're only able to check once a day, move that target around a bit so we have a good variety of what your sugars look like. So I'm going to go gather our viewers' question, come back and address that, which will lead into next week's topic as well. Be right back. Okay, I decided to clean this up and recap it for you because I don't think I went over 2 hours after meals or bedtime numbers. So basically, to recap, this is your waking day. You eat breakfast, lunch, and dinner, and in doing so, it's going to cause your sugars to rise accordingly. When you first wake up, if you have a sugar between 70 to 130, that's good. Some people prefer to keep it a little looser, more like 100 to 130. Not quite as strict. Most people tend to feel a little worse if they're waking up and their sugar's already 70. 2 hours after any meal, if you're less than 180, that's good. You may find that certain meals will cause it to rise more, and that's when you can start focusing on your portion sizes and what your meal is made of. Maybe cutting back on the carbs that we'll get to in just a second. So 2 hours after any meal, breakfast, lunch, or dinner, less than 180 is good. And then coming back out here to bedtime, I sort of mirror what we do when we're waking. If your sugars are between 100 to 130 at bedtime, that's good. If you're going much lower than that, you're running the risk of having low blood sugars throughout the night if you're on certain medications. But that, in a nutshell, is how you want your day's sugars to look. These are your targets. And we use these targets to guide our drug therapy. And certainly, if you're not on medications, we can use these targets to help coordinate a better meal. All right. So speaking of which, I'm going to get to our viewers' questions from last week. But first, I'm going to clean the board up because I have to draw some more graphs. Be right back. Okay, gang, we're back with our first viewer question from last week. So last week, Esther Zapata asked, are there any foods we can eat that increase insulin? Or are we doomed to take insulin shots? Esther's a friend of mine. One of the first to subscribe to my channels. Thank you very much. And I'm going to give her a little bit of grief right now. Doomed might be a bit of a strong word when it comes to insulin. And we too often treat insulin like it's a bad word. Insulin, for the people that have to use it, is actually the right tool for that moment. I will often take people off of insulin that I've put on insulin because of their changes in their meal patterns. So to get straight to answering your question, are there foods that increase our insulin? Yes. That might not be a good thing. I know what you're getting at. Can we help our pancreas work better to make more insulin? Actually, diabetes, once it's diagnosed, it's been brewing for decades because of this right here. This red line represents what happens to your sugar when you eat carbohydrates. Extremely high, and it doesn't last for long. Insulin follows these curves. So if your carbohydrate load is going really high in your bloodstream, guess what's trying to chase that sugar to get it into the cells? Insulin. And it's years and years of high carbohydrate or high sugars and a lot of insulin being secreted by the pancreas to try to get that sugar out of the blood into cells that sets us up for prediabetes, for other metabolic syndromes, and for diabetes ultimately for some people. About 50% of Americans right now either have diabetes or prediabetes, and that's a staggering number. But look what happens over time. So you eat carbohydrates, your sugar goes up quickly and doesn't last for long. If you eat protein, it's a much slower rise that lasts longer. And look at this. If you eat healthy fats, hardly any rise in your sugar at all. And remember, insulin follows these lines as well. So the more carbohydrate you're eating, the more your body is having to produce insulin to chase that sugar and get it into the cells. So the smart thing to do, number one, is to cut back on your foods that are high in glycemic index. Simple carbohydrates, your white rice, your white bread, pasta, any type of processed foods are going to dump sugar into your bloodstream really quickly, and you're going to be hungry again in about an hour. Because guess what else happens with insulin that's being secreted into your bloodstream? Makes you hungry. And in the end, it also helps store fat, which sets up a pretty vicious cycle. If you add a little protein to the meal, though, some healthy proteins, your sugar is going to last a lot longer and you're going to feel much more satisfied for a longer period of time. Even more so if you add healthy fats. The problem with heavily refined, simple carbohydrates is that you don't get the benefits of things like fiber and whole grains that helps slow down the absorption process for the sugar. But that's going to be our topic upcoming next week, because we're going to talk about how food affects diabetes and what things we can do to try to eat better. Now, I'm not a nutritionist or a dietitian or a food expert, but I'm going to give you my best 2 cents worth on what I tell my patients that have helped. And I'm also going to try to get the advice of a friend of mine, Dr. A, he doesn't know this yet, who's currently helping me with my diet. And I've lost maybe 13 pounds since mid-November. And right now this is, what is today's date? January 18th. So I'm on the right track and I'm feeling really good. So some of those tips and tools I'll share with you next week. But for now, this is Dr. Max signing off, and this has been Diabetes Solutions. If you have questions that you want answered, send it, put it down in the bottom. I'll address it next week and highlight you just like we did Esther this week. And for Esther's question this week, she gets 1,000 points, which means absolutely nothing. Bragging rights, Esther. First question up. Okay, see you next week.